Hello everyone, welcome to my channel. Today let's discuss about thyroid profile report. Many patients come to clinic with thyroid reports and ask one simple question. Doctor, is my thyroid report normal or not? So today I will explain you total 7 patterns how to interpret thyroid reports using 3 important tests, that is TSH, T3 and T4. And once you understand the relationship between these three, reading thyroid reports becomes very easy for sure. So let's first understand what these hormones mean. TSH, that is thyroid stimulating hormone. This is produced by the pituitary gland in the brain and it tells thyroid gland how much hormone to produce. T4, that is thyroxine. This is the main hormone produced by thyroid gland. And T3, this is the active hormone that controls the metabolism and energy in the body. Wait, we have two more friends, that is free T4 and free T3. इसको कैसे भूल सकते हैं? Free T3 and free T4 are the important parts of thyroid function test. They help us understand how well your thyroid gland is working. Now, what is free T4? Free T4 is the thyroxine hormone that is not bound to proteins in the blood. This free hormone can enter body cells and perform its function. T4 is the main hormone produced by thyroid gland and later converts T3 into the body. Free T3 is the active thyroid hormone that is available for the body to use immediately. It directly affects metabolism, heart rate, temperature and energy levels. Simple way to remember, that is free T4 stored thyroid hormone and free T3 is active thyroid hormone. Think of thyroid hormones like money. T4 is the money in the bank and T3 is the cash in your wallet which is ready to use. अब इतना तो समझ में आ गया. Now let's begin with the main part and understand all those 7 patterns which you could see. The first common pattern is if the TSH is high and T3 and T4 are low. This usually indicates primary hypothyroidism. In this condition, the thyroid gland is not producing enough hormone, so the brain tries to stimulate it by increasing the TSH. Other common possible conditions include Hashimoto's thyroiditis or post-thyroid surgery or patients with post-radioiodine treatment. Patients may experience symptoms like fatigue, weight gain, cold intolerance and hair fall. So this was the first pattern. Now let's understand second pattern, that is when TSH is high but T3 and T4 and free T3 are normal. Here the thyroid normals are still normal but pituitary gland is already working harder. Many patients may not have symptoms at this stage and we may simply monitor the patient or start treatment depending upon the situation. Here this is a subclinical hypothyroidism. Other possible condition where we can find this pattern is in cases of autoimmune thyroiditis or Hashimoto's thyroiditis. Pattern number 3. Now what if TSH is low, T3, T4 and free T4 is also low? This indicates secondary or tertiary hypothyroidism. So we have seen 3 patterns for hypothyroidism. Now let's look at the opposite situation. If TSH is low and T3, T4 are high, this indicates the patient has hyperthyroidism. This means the thyroid gland is producing too much of hormone. Common conditions include grave disease, toxic multinodular goiter or thyroiditis. Symptoms may include weight loss, palpitations, heat intolerance and anxiety. Fifth pattern. Here, what if TSH is low but T3, T4, free T4 normal? This is subclinical hyperthyroidism. It means thyroid is slightly overactive but hormone levels are still within the normal range. Now, what if all the levels are low? Patient का TSH T3 and T4 level सब low है. This typically indicate secondary or central hypo. The issue is likely rooted in the pituitary gland and hypothalamus in the brain, which is not producing enough stimulation, that is TSH, rather the problem with the thyroid gland itself. Pattern number 7. What if all the levels are high? The possible condition could be TSH-secreting pituitary adenoma. Now these are the rare, usually benign tumors, 0.5 to 3% of pituitary adenomas, that causes central hyperthyroidism by secreting excessive TSH. Now we have seen all the 7 patterns which could be commonly seen in patient. Remember this simple rule: TSH moves opposite to thyroid hormones. High TSH, low thyroid, that means it is hypothyroidism. Low TSH and high thyroid, that is hyperthyroidism. Once you understand this relationship, interpreting thyroid reports become very much easier. If you found this helpful, subscribe to our channel for more medical explanation and clinical videos. Thank you.